So first, I'm going to be checking my physician's order. Next, I'm going to be washing my hands. And next, I'm going to be identifying the patient. Can I have your name, please? And I'll be verifying her first and last name and her birth date from her ID bracelet and making sure that it's correct on the computer. Next, I'll be identifying myself. My name is Sherry. I'm going to be giving you a bed bath fee. Are you okay with that? Great. She's approved, so now I'm going to close the curtain. So first, I'm going to be applying gloves and filling up a basin with warm but not hot water, and making sure that the temperature is okay with the patient. Then I am going to make sure that the bed is at working height, and I'm going to lower the side rail, and I'm going to be putting a bath blanket on for my patient. Then I'm going to be removing oh yeah, could you hold on to the top of it, please, just so you don't get exposed. I'll be putting this in a hamper. Next, I will be helping her remove her hospital gown, and if she has any IVs, I'm going to make sure to string them through and work on the arm that doesn't have the IVs first. Removing it, disposing of it in the dirty hamper. So now I am going to be washing her face with just water, not soap, from the inside out and from the inner corner of the eye to the outer corner. And the ears and the neck as well. Next, I will be washing her far arm. And I will be placing this towel underneath it, just so that no water goes down when I'm washing. Then I am going to be getting some soap and water and washing the patient's arm from distal to proximal, while also being sure to support her joints while I'm washing. And I'm not forgetting to wash the axilla. Okay. Then I'm going to be rinsing in the same fashion from distal to proximal while supporting her joints and also the axilla. Then I am going to be patting dry to prevent any skin breakdown and making sure to dry the axilla too. Then I am going to be removing this towel and covering the patient's arm. I'm only exposing the body part that I'm washing at the time to prevent chilling. Again, I'm just making a mitt of some sort just to make sure that there's no loose pieces of the towel dragging on my patient's skin. So I'm going to be getting some soap and water and washing distal to proximally while supporting the joints. And I'll be doing the underarm as well. I'll be rinsing in the same way. And pat dry.
Maybe guys go see someone else's car.
Next, I will be washing the patient's chest area. I'll be removing just the top while keeping the abdomen covered. I'll just be putting this here just to, so no water goes down or anything. Now, it's just with some soap and water, and again the mitt to make sure there's no dragging pieces of towel. I'll be washing the patient's chest, and for women, I will be make sure to be washing underneath the breast, and then I will be rinsing in the same way. Also underneath the breasts, and then I will pat dry, like so, and also make sure to dry underneath the breasts and any other skin folds. Then I'll just bring this towel up a little bit to cover the patient's chest and prevent chilling as I begin to work on bathing the abdomen. Water and soap, washing the abdomen, inner to outer, and then I'll be rinsing and patting dry. Next, I will be covering back the patient. As to prevent showing. I'm taking out this towel. So next I will be working on my patient's legs. I'll be again putting this towel underneath her leg and supporting her at the joint. Great. And I will be getting some soap and water and washing from distal to proximal, but being careful to avoid the feet because the feet are pretty dirty. Again, supporting at the joints. Then I'll be rinsing.
Yes, and we don't have to have 3 people, so I can help Diego out.
And patting dry. I'll be covering that and just removing this towel. I'm going to be doing the same thing on the other side. Rinsing. And patting dry. I will be removing this towel and placing it under the feet so that I can begin to wash the feet. Water and soap. From top, bottom, and in between the toes. Top, bottom, and in between the toes. And then I'll be rinsing. Top, bottom, and in between the toes. Top, bottom, and in between the toes. And then I'm going to be drying the feet. Making sure to dry in between the toes. There's no fungus or anything. And then I am going to be removing this towel, covering the patient's feet. Now I'm just going to be lifting the side rail of the bed and lowering it to the lowest position so that I can change the water and perform hand hygiene, take off my gloves and put on some new gloves. Okay, so I did that. And next I am going to be putting the side rail back down so that I can work on my patient again. And I'm going to ask you to help me please turn over just so that I can begin to wash my backside. Thank you. I'm going to try to keep my patient as covered as possible. So now I'm just going to be getting some soap and water and washing my patient's back and buttocks. Now while I am doing this, I am being sure to check out for any skin breakdowns, especially in the sacral area. Now I'm going to be rinsing in the same way. And I would be patting dry. Next, I would apply back lotion, unless otherwise indicated by the doctor. So now, for the rectal area, I am going to again lower the bed to the lowest position and cover my patient just so that they're not exposed, and raise the side rail up and change my gloves. And if there's any fecal matter on in the rectal area, I'll be washing with a tissue before I go in with a bath rag and wash with soap and water. And then once I'm done with that, I will lower the bed again and raise the side rail so I can change my water and wash my hands and change my gloves again. Okay, so now I'm back after I did all of that. Now I have fresh water for the perineal area and fresh new gloves. So for the perineal area, I'm just getting some soap and water, and I'm making sure to wash from front to back, and also rinsing from front to back and patting dry. Can I please ask you to turn back over, miss? Thank you. And then I am just going to be putting on a new flat sheet for my patient. going to be taking out the back blanket from the bottom. And again, before I did any of this, when I was done with the perineal area, I did change my gloves again because it's not sanitary to be using the same gloves that you used in the perineal area to change the sheets and on any other areas of the body. So next, I'm going to be helping my patient put on a new hospital gown, like so. Also, again, being careful with any IV tubing and making sure to string them through, making sure my patient is warm and comfortable. And then now's the time that I would ask my patient if she would like any deodorant or any other lotions or emollients. If she requires any emollients, I would be putting them on now. And then I will be raising the head of the bed. Raising the side rail. And then I'm going to be giving my patient the call bell and asking her, would you like anything else? Say a blanket? Okay, you feel better? You feel nice and clean? Okay, and I'm going to be lowering my bed to the lowest position possible. Side rails are up, my patient is safe, clean, and happy. And she has the call button, and I'm going to be washing my hands and throwing away my gloves. That's it.